Welcome. Inhalers Crash Course. Types, Technique, Counselling, and PEBC-style MCQs. We'll focus on common Canadian products: Ventolin, Symbicort, Spiriva, and Omnaris. Here's today's roadmap. What inhalers are: device types, technique checklists, counseling pearls, then 6 exam-style MCQs with answers. Inhalers deliver medicine straight to the airways. But technique errors are the #1 reason patients feel the medication doesn't work. Always ask, can you show me how you use it? Rescue inhalers are for quick symptom relief. Maintenance inhalers prevent symptoms and flare-ups and must be taken regularly. Ventolin is rescue. Symbicort and Spiriva are maintenance. Know the big device families: pMDI puffers, dry powder inhalers, soft mist devices, and capsule devices. You'll also see nebulizers and nasal sprays like Omnaris. This table is your device cheat sheet. pMDI with spacer is common for kids. DPIs need a fast, deep inhale. Respimat is a soft mist often used in adults. Capsule devices like HandiHaler require loading and piercing a capsule. Nebulizers help when coordination is difficult. Omnaris is a nasal steroid approved for age 12 and up. pMDI technique: shake, breathe out, start a slow inhale, and press once. Keep inhaling slowly, then hold your breath. PEBC loves spotting pressed before inhaling and inhaled too fast. Spacer technique: 1 puff into the spacer, then inhale right away. Kids could take 5 to 6 normal breaths or 1 slow, deep breath. Clean weekly and air dry. DPI technique: load the dose, breathe out away from the device, then inhale fast and deep, hold your breath, and keep it dry. Never exhale into a DPI. Respimat: prime as directed, turn the base, open the cap, breathe out, then inhale slowly while pressing the button. HandiHaler: place the capsule, press the piercing button once. Inhale deeply and listen for the rattle, then repeat to empty. Remove the capsule, never swallow it. Confirm rescue versus maintenance. Demo technique: rinse mouth after inhaled steroids, track dose counters, and watch red flags like frequent rescue use or night symptoms. Ventolin is rescue. Symbicort is ICS/LABA maintenance. Rinse mouth, and asthma indication is age 12 and up. Spiriva is LAMA maintenance, not a rescue. Omnaris is for allergic rhinitis in the nose. Now practice time. Answer each question first, then check the explanation. These are PEBC-style device and technique traps. A 4-year-old on salbutamol pMDI. What's the best advice? pMDI plus spacer and a mask if needed. Which pMDI technique error most reduces lung delivery? Pressing before inhaling. What should you teach for a dry powder inhaler? Inhale fast and deep and never exhale into the device. Which option is a maintenance controller medication? Symbicort. What's true about Spiriva? Once daily maintenance bronchodilator, not rescue. Omnaris is best described as what? Intranasal steroid for allergic rhinitis, approved for age 12 and up. In the next video, we'll cover asthma from zero, triggers, diagnosis, step therapy, and PEBC case framing. Subscribe and click the bell so you're first to see it.